I always like to start just by kind of getting a show of hands. Who here is attending their first diversity dialogue, first diversity luncheon? All right, so a couple hands. That's great. We love to see staff making it to these presentations, conversations. So for those that are coming for the first time, a quick overview of why we do these. These have been going on for several years now here at Mountain Park. Put on by the Diversity and Community Affairs Department, really as a way to continue to provide a space for staff to learn about patients of ours that we feel like are even kind of more at risk than the general population that we serve. So these vulnerable patient groups that we learn about either from staff who are working with our patients day in and day out, or patients themselves. We want to put together presentations, discussions that'll create some more understanding, hopefully lead to better healthcare delivery, customer service. And so that only happens through kind of creating an opportunity to have a little bit more in-depth conversation about a specific topic or community. So that's a bit about the dialogues. And really, we get the most out of these when everyone is able to kind of just get curious, ask questions of our guest speaker, and share kind of your input, your thoughts on the topic. So with that, we'll get started. We're really excited to have Sherry Johnson from the Maricopa County Sheriff's Department here today to share her over 30 years of experience working with the reentry population, trying to reduce rates of recidivism here in South Phoenix. Has a lot of good experience, right? But before we get to Sherry, just a little bit on, again, why we chose to try to better understand this patient group. Last year, we came across some data, some research that let us know that for this population, their mortality rate really is 12 times that of the general population that we see in our clinics in the first 2 weeks as they're cycling out of incarceration. So we saw that there was a great disparity in that health outcome, and we wanted to do our part in improving access to care, taking better care of them when they're in our facilities to try to improve those health outcomes, right? So that's really what kind of got us curious, kind of got us going down this rabbit hole now of creating a work group in Maryville with several different staff and community partners that are talking about this kind of patient group and these goals, right, to better serve the population. So again, we know that these are some of the challenges that they are undergoing, and we're just trying to think about what we can be doing here at Mountain Park to do our little part in improving how they're cared for, right? So that's a little bit about why we wanted to delve into this topic, this patient group, and really kind of how we got here, right? So it really started with our first diversity dialogue on the topic last year in August at Maryville. We were able to have the ACLU come and present at that dialogue to really introduce the topic. And what we felt like is just kind of put a face to that community and try to decrease some of the stigma that's associated with this population. There's many kind of ideas, misconceptions perhaps, of who these individuals are. So we wanted to kind of put that human face to it. And it was really a dynamic discussion. We felt like well received. And so we knew that it's this sort of thing isn't just kind of figured out in one diversity dialogue. It's something that we're committing to for years ahead, right? And so we wanted to come back to the discussion after having kind of tried to reduce some of the stigma. Now we're going to delve a little bit into what are the kind of some human stories, some actionable ways in the clinics that we could be doing in our own way, in our own roles to better serve this population. So that's a little bit of kind of how we got here, the diversity dialogue. We provided a tour of Maryville with external partners that work with this population that are giving us good feedback. And now we have this work group, as we've called it, identifying some key areas that we want to see some progress in going forward. So this is just kind of a part of that process. So with that, I'm going to hand over the clicker here to Sherry, but a quick bio on her before we do that. So Sherry Johnson has worked with the Justice Evolved population in Maricopa County for over 30 years, 27 years as a probation officer, and the last 3.5 with adult programs at the Maricopa County Sheriff's Department. Her expertise is on community collaboration, resources and recidivism. In fact, she was a part of a collaborative corrections team that worked on reducing recidivism in 2008 through 2011 in the zip codes of 85040, 041, and 042, which are all in South Phoenix, all in our service area here at the Baseline Clinic, right? So really kind of some on-the-ground experience in this very community. She has written or managed several federal reentry programs for the justice involved, reintegrating back into our communities, something we're really interested in kind of learning more about and seeing how we can get plugged into those efforts. She hopes to share some of her experience with you today in helping you better serve and understand this vulnerable patient group. So let's give it up for Sherry.
How is everybody today?
Good.
Good. We're happy to be here. With me is my commander. Her name is Bridget Mack. She came to hang out with me today to see what I do on a Friday. Actually, this is not what I typically do on a Friday. I just had a group of inmates in a cluster this morning from 8 to 10, so this is nice having faces today. While we're going through the slides, I like questions. I love questions. So feel free to raise your hand if you have a question that pertains to the slide or something that you wanted to know about, something that you've seen in here and you're just kind of curious about why. All of that made me sound really old, and I don't feel old, but I have lots of stories and lots of experience that I want to share with you guys today. So please ask questions. So when I was asked to come here to talk to you guys a little bit today, I wanted to kind of give you a feel for where are the people that you're seeing possibly coming from. And so we have them coming out of prison here in Arizona, and you could see people from the 15 different prisons coming in here to the clinic that you could be talking to that just got out yesterday after 9 years. You may or may not even know that about them unless they happen to mention that. You also may have them coming out of the county jail. We have 5 county jails here in Maricopa County, and most of them are unsentenced inmates that are waiting to find out what's going to happen to them, so roughly about 8,000 in the population. And then you have over 60,000 people on Maricopa County probation alone. So again, unless they mention it when they come in the door or they're talking to you during an assessment or during an interview, you may or may not know that, but there's some things that you can look at or some key signs that maybe they need some help, and you may be that person that helps them, okay? That recognizes, hey, maybe you need some help in this area here. Let me tell you where you can go for that, or let me help you with that. And so you just never know when you could be that person that changed the way their day was going to go and set them on a different path. So, who's being released? Everybody, and they're people. Okay, that's the one thing to really remind yourself of. You know, sometimes when I'm busy and I'm talking to inmates and stuff, I have a 23 and a 25-year-old at home, okay, or actually one's on their own, but they're my kids, okay, and very easily a wrong turn, they could be coming out of one of these facilities, okay. So they're people, their mothers, their fathers, their grandparents, their nieces, and their nephews, they're our own kids, okay, and it's important to remember that, and that they need help as well. So just keep it human, because that's one of the biggest things that they need when they get out of jail or prison, is that friendly face, non-judgmental. What can I do to help you to be successful? Okay. All right, so why do you think people return back to jail and prison at such alarming rates? Any ideas?
Well, they have it. They're used to what their life was like in prison.
It's the lifestyle, and it's also comfort. They know where they're going to get their meals. They don't have any bills. They don't have a whole lot of stress. Their stress is different than our stress, okay? And they're comfortable there, and they can socialize there because there's a lot of their friends there. Okay. Why else do you think they return so quickly?
They can't find jobs.
Can't find jobs. Okay, there's a lot of places. In 2010, second chance reentry programs were hitting across the country really big, and there's a lot of employers that will give second chances. When I had a caseload, all of my people were employed. I had a jail caseload where they were actually serving a jail sentence, and they were getting released from the jail to go out in the community to work, and they had jobs where employers were giving them a chance even though they were an inmate in jail. Okay, so those places are out there, and everything's about second chance these days, especially in 2019. People want to help these individuals, because if we don't help them, what's going to happen? They're coming back, and they're going back in, and they're going to come out again without help, and they're going to be coming to our neighborhoods committing crimes. And And so we have a choice to be part of the solution or part of the problem. And so I always want to be the one that's part of the problem, or part of the solution. Why else do you think people come back? I want to make sure you were awake on that one. So there you are. What else causes people to return back to jail and prison, do you think? We have employment. We have comfort. What else? Yeah.
Maybe they're returning to friends who were sort of part of why they got in trouble in the first place.
Okay, so we call those negative companions because those really aren't friends. Okay, they're not like our friends. Okay, and that's good because we are. That is a big risk factor, as we're going to see in a few minutes. What else? Something else? Not knowing how to be responsible or not having coping and problem-solving skills like we probably have. Maybe they missed that part when they were growing up. Okay, and they see one solution, that's go get high or go break into a car when they're faced with an issue. Some of their biggest risk areas are divorce and death for coping skills. They don't have those coping skills. Or separation, or a breakup with a significant other, or the loss of a child. Loss of a child just with DCS being taken away, but also the death of a child. They don't know how to cope, and they go to what they know, and what they know is criminal behavior. Okay, so coping skills, lack of problem-solving skills, negative companions. Anybody have any others?
Being social.
Yeah.
Well, maybe they don't feel that safe outside, so they feel safer inside the prison because they have a pending or ongoing issues or challenges outside of the prison.
So again, you have the comfort. They know that. Okay, that's what they know. They're good at that, and sometimes being successful freaks them out a little bit. If they get together a couple of weeks or a couple of months of being clean and sober, and actually things are going well, they're not used to that, and they'll actually sabotage that. We call it self-sabotage. And then they'll do something to get in trouble, and then they come back because that's what they know. Okay. So let's talk a little bit. Well, so wouldn't it be nice if we could predict who's at risk to go back? Because we could actually intervene in that. And that's what some research came out in 2003 from Ed Latessa and some other researchers. And what they looked at, people coming out of jail and coming out of prison, what were good predictors? What were the warning signs? What were the areas? And they came up with the big four and then the next four, and it's in any order, the top four, any order, and then the next four in any order. This research came out in 2003, and then it was validated in 2005, and it hit the country like crazy. And every organization, criminal justice organization, started doing their risk assessments based on these big 8 criminogenic risk factors. And these are the best predictors, even in 2019, of whether somebody's going to come back or not. And this is looking at their life. Okay, so you see negative companions are up there. She had that right on. You are who you associate with, and that's what we tell them. And that's why it's so important when they get out of custody and they come back out to the neighborhoods that they're careful. There's regulations on who they can associate with and who they can't. And sometimes those people are their own family members. Okay? I've had many guys tell me that they got high the first time with a mother or a father, which is very sad. Okay, but it's reality. Their reality. Their criminal thinking. Okay, their criminal thinking, and assuming everybody in here has never been in trouble before, we don't have criminal thinking, but they have it, and it's something that they were raised in, whether it was cultural, their environment, the people they were hanging out with. So an example of their criminal thinking that gets them into trouble is, well, shoplifting, yeah, everybody does that. Because they think everybody does it. But we know in reality that not everybody does that. So if you go through life thinking, yeah, it's okay to steal because everybody does it, or just one time won't hurt. Okay, these are some of their beliefs that have to be challenged, and that's what we challenge them in the jail when they're in some of our programs. We challenge that belief system, because if they continue when they get out with that belief system, what's going to happen to them? They're going to come right back in. So we try to challenge them with that. Lack of coping, problem-solving skills, which I mentioned, and then their criminal history. The longer the criminal history, the more apt they are to keep coming back. But if they get well in the other 7 areas, then they don't come back regardless of their criminal history. We have a volunteer that works in the jail. He volunteers his time. He's got 8 felonies. He was a gang member in California. He got his life together, and he comes in to spread the word and work with the inmates. So you can overcome criminal history if you get the other 7 areas of your life under control. Over here on the next 4, you have drugs, alcohol, and pills. I'm sure you guys see that all the time. And you know, we're dealing with it too. The heroin and the methamphetamine are huge, and the fentanyl. big problems. And it's probably 80–90% of my classroom, in any class that I have, it's split between heroin and methamphetamine, very high numbers. Social, then under the next four, that is their significant others and problems that they have with boyfriends and girlfriends and husbands and wives, and the drama that goes on in those relationships are not always healthy. It's also their upbringing. It's the aunt and uncle that raised them, and the grandparents, and the mother and the father that maybe had criminal history going on, and that's how they were raised in the household that age. Or they had abandonment issues where the mother took off and left them with the father was out doing stuff, and then they kind of had to raise themselves. So the dysfunctional social, the upbringing, and who raised them is a big indicator when you look at somebody. The social is also where they learn you don't go to the doctor unless you're dying. Okay, and I'm not to pick on the men, but that tends to be a little bit more common. Okay, if it's not fixed, don't break it. If it's not broken, don't fix it. You know, I'm not bleeding out, I don't need to go. And preventive things with the men, forget it. Okay, so that is one of the things that we have started talking to the men that I work with in our programs is preventive health care. Okay, because they have no idea. No idea.
And especially if they're on drugs, that's the first thing they can think of. They're gonna test me, they're gonna know I'm using drugs, they don't wanna go to the doctors.
And then I'll also guarantee you that when they get off the drugs, the alcohol, and the pills, they're gonna feel all those aches and pains that they've been ignoring. Okay, and then all of a sudden it's like, maybe I should go get looked at. Okay, and so we'll get back to that in a little bit. And then lack of education or employment, and that somebody mentioned employment and barriers to that, but they can't overcome that, and there's so many people that wanna help them with employment. And then boredom, they get bored. They don't know what to do with themselves, so they go do whatever impulsively they decide that they want to go do, and boom, you've got criminal history attitude. We know what to do with boredom. We read a book, we go to a movie, we go exercise, we know what to do. They get bored, they go out and do something that's going to be bad because of their criminal thinking. And so we try to keep them busy in some of our jail programs. Like we have a class right now, it's 8 to 3 Monday through Friday. Discipline goes down because they're kept busy. So if you keep people busy with pro-social activities, and a lot of them don't know what those are. So I'll tell them, you know, go listen to music, go meditate, go to church, go to the park with your kids. And they're like, wow, really? And we try to find low cost or no cost things for them to do because a lot of people don't have that money to be able to do that. So anyways, these are the indicators. So when you see somebody come in and there's some issues with, you know, who they're hanging out with, and they're talking about, you know, dysfunction at home with a significant other, and their kids are all over the place, and they don't have them together, they're trying to get them back. They're looking for employment. I mean, these are all signs that they are probably at a risk to come back. And so you might be that person that gives them the referral, or say, hey, what about Father Matters? They're in this zip code. They can help with, you know, with X, Y, and Z. You need clothes. Okay, this is where you can go. You need food. This is where you can go. So you have the ability to really impact people if you think about it. All right, so 8501 project. I was asked to talk a little bit about that because that's where we're at right now. And this was a very unique project because we had the ability to collaborate, and it made a difference, and it showed. So in 2008, the Department of Corrections looked at who's coming into prison and where are they going to. And guess what zip codes they found? 40, 41, and 42. And there was a large percentage of men between 18 and 24 coming into prison from these 3 zip codes, and they going right back out to the same household. And so they wanted to do something about that. So what they did was they moved all of them in the prison system, who were going to be getting out 6 months before release. They put it in one facility, and then they offered all kinds of resources and services and stuff to them. And then they got parole involved and probation, depending on where they were going when they got out. And then they got those 2 agencies working together. Because normally those 2 agencies are one state and one is county, and you typically didn't have much overlap. You had a big partnership here. And then what they realized was there was not a lot of resources in these zip codes. They didn't have a lot of employers. They didn't have, transportation was an issue. Motor vehicle department, where do you go for that? And so what they did was they started bringing some resources in, and they started collaborating. They got South Mountain Community College involved. They got DES on Central. They put parole officers in there. So you could go and you could go enroll in whatever you needed to enroll in DES, and you could see your parole officer while you were there. They got religious people involved. They got apartment complex, employers. And so they started collaborating with this population, and they noticed that their return rate on going back to prison or jail had been lowered. And they saw a success rate after the years when they were finished with it, rise about 15% as far as success rates go because of the collaboration and because of the warm handoff that they had. All right, so any idea what it would be like for somebody that's getting out of jail or prison for anywhere from 6 months to 16 years? Any idea what it might be like? Here's the door, go. Back there.
Traveling?
What's that?
Well, for the 16 years, like time traveling,
Yes. That's a cell phone? How does it work?
right? Computer.
Can you show me how to work the cell phone? I had one guy actually say to me, Sherry, don't call me on the cell phone and leave a message because I don't know how to set it up. So if I don't answer, just keep calling back. Okay? Back there? What would it be like? Anybody?
Scary, very scary.
Would it be scary?
Unknown.
Anxious. Anxiety is the big one. Whether it's jail or prison, there's a lot of anxiety. And it's right before they get out, even though they're excited about getting out, it's anxious. Because they don't know where they're going, they don't know what they're going to be doing, they don't know how things are going to be. They change, people on the outside change. I had a mother and father pick up their son after 5 years. And they brought him home and they told me in the office, they said, we don't know who that is. He had no tattoos when he went in. He came out fully tatted up. And we go home and he goes in his room and he shuts the door. He doesn't talk to us. It's like we picked up a stranger on the side of the road. People are out there. And I'm like, well, I think that's your mom and dad. He goes, yeah, I know, but I don't know him anymore. And he's like, it's very awkward in the house. So I said, well, what did you do? He said, I went in my room and shut the door. So I got them in the same room to communicate that because they weren't communicating. Okay, but it can be very awkward, very stressful. Heard lots of stories, but it's very hard for them when they first come out, especially depending on how their coping skills were when they were in. I thought just because they were in for a long time, they're automatically going to have a hard time. That's not necessarily the case. I've had a girl get out after 9 months and she was a mess. Her coping skills were really bad and she was very, very stressed. And then I had a guy get out after 6 years and he did pretty good. Okay, so again, the coping skills that they have while they were in there and then when they get out. All right, so there's your anxiety. If you don't have an anxiety problem before you get there, you have one when you come out. Okay, doing a class this morning, they called for meds. Half the room went out in the hallway to get their meds. Okay, there's a lot of people on medication because anxiety's high. Anxiety, depression are some of our bigger ones. So you're going to see sometimes, depending on how they're coping and how they're doing, they may not want to go anywhere for the first couple days. They may want to just stay home because it's safe at home and it's scary out there. There's too many people. It's too loud because depending on where they're coming from, everything's moving too fast and too much for them. And so we'll often find the first couple of days they won't want to go anywhere. They don't want to do anything. And so that's where sometimes I have to educate the family members because what do family members want to do when they first get out? Their loved one just got out. What do they want to do?
They want to have a party.
We want to have a party. Come on, let's go. We want to go to Walmart. We'll give you $100 on a Saturday. You go pick out a couple shirts, a couple pair of pants. No, not good. Ask that person. Okay, because they may not want to do that. And that actually happened, and he couldn't pick anything out because there was too many choices. When you're in jail and you're in prison, you don't have very many choices. So when I give you $100, I tell you go to the men's department and get a couple shirts and a couple pair of pants. Do you have any idea how many kinds of shirts there are? Okay, it's overwhelming for them. When they get overwhelmed, then they will close up. And so you will often see that. Time. It takes a while for them to acclimate themselves to jail and prison. And then once they get used to it, and they leave, then what happens? The sights and the smells are different. They have a pillow again, maybe, because they don't have a pillow usually where they're at. Everything is different. The noises are different, and it takes them a while. So I noticed when they're coming out of prison, they wake up very early and they can't sleep. Okay, and it takes them a while to get back onto some kind of a regular type of system. So it's very hard for them. So sometimes I see them 11 o'clock in the morning and they're all laying on the couch sleeping. You know, what's going on? Sure, I didn't sleep last night at all because I just couldn't sleep. I don't always assume that they're just lazy and they're just on the couch. I'll ask them, you know, what's going on, and that's what they would tell me. Okay. Very routine, jail and prison. Okay, to where they don't have to think, they don't have a lot of choices. They know what's going to happen every day, and then when they get out, guess what? It's chaos because they don't have a schedule. So we try to incorporate and tell them, whatever worked for you when you were in, try to do some of that when you get out. If it's exercise at a certain time, eating breakfast at a certain time, grooming at a certain time, try to keep with a schedule, because if you don't have that, they appear lost when they get out. Yeah?
Was seeing a doctor a part of their routine for those that are diagnosed with a condition? Like how does some place like Mountain Park factor into their routine when they come out?
Good question, because the guy on the way out today, when I asked him in class, you know, what would produce you to go out as soon as to go to a doctor as soon as you get out, and they said if we have an ongoing health condition, or if we are on medication, we're going to be going to a doctor, medical or mental health medication, we're going to go. So he said definitely he would be doing that. I've had people before that had liver problems, that had high blood pressure problems, and so yeah, you're going to see them here. Thankfully, you're gonna see them at a doctor clinic, or they're going to be coming somewhere to get help. It's the ones that haven't been getting anything, or have been getting it in prison or jail, and it's not life-threatening, and maybe that's where some of the priorities are going to be for them to get other things like housing and a place to stay and clothes and food, and then they're going to be thinking about going and seeing providers. DOC and county jail are both trying to get people enrolled in access if they're not already enrolled, so that when they get out, they're not waiting, they're not putting it off, and hopefully they can get an appointment pretty quick so they can get in there. So we are trying to encourage that, especially if they have a mental health condition or a medical condition. So there's a bigger push on that than there has been in the last 5 years, but we still have room to improve to try to get people enrolled. My classes, I look up on Access, if they have it, when is it going to expire, and then 45 days to the gate, I can enroll them. I'm an assister, so I could actually enroll them in Access so that they have it when they walk out. If it's something that they're signed up for already when they get out, it's one less thing that they have to do. And that's what we try to eliminate, is all that stuff on their plate that they have to get out, because being overwhelmed is big for them. Okay, it's big. Things move too fast when they, yes ma'am.
Question. In regards to their medical records, do they get released when we ask for them, or do they give them something before they leave, if they're diabetic or?
They will give them medication. So they'll typically give them a 30-day supply of medication. As far as medical records go, they would have to request them or sign a release for you to request them. So for the prison system, it's going to be Corzine that has the medical records. For DOC, they have the contract. And with Maricopa County Sheriff's Department, it's going to be our correctional health services that you would try to get those records, but they don't move very fast. That's the problem. It tends to be a little slow. So if they ask for them right before they get released, that would speed things up, and that's something certainly we can tell them to do as well. So if you have that information. Yeah.
So I'll just add to that we've been working with Mercy Care, a health plan that sends patients, clients our way. And we've asked that very same question about getting a medical record sheet when they're scheduling the appointment with us. And I believe we're working on trying to get that. I think there's a variation of that. I don't want to confuse the terminology, but I think we're able to get some information, but I don't know about their full medical record history. But that's something that we're asking of them when they're scheduling the appointments with us.
Yeah, because they can go to the doctor and see, they can put in what's called a tank order to request to see a doctor for certain things, and that's something that would definitely benefit you guys if they did the release, and you would have that information. And it also helps in the case if they're trying to apply for Social Security disability. So everything moves too fast, so we try to slow things down for them when they get out. All right, my experience has been to ask them when you're scheduling appointments, to say what works for you, because some may be on a bus, some may have family members that are going to take them and they don't get off work until a certain time. If they are having anxiety problems, you might want to warn them if they come in at a certain time or after a certain time, the lobby may be very busy. I can tell you a number of people that I've worked with, if they walked into this, they would walk right back out and have a panic attack. And we had a girl do that. We had to schedule her at 7 o'clock in the morning because the office where she had to report to on probation would hold 75 people. And initially we had her scheduled at 3 o'clock in the afternoon. And she lost her stuff when she came in and went out in tears. So ask them, in the morning, when your busy times in the lobby. So tell them, you know what? But you may not know that they just came out of prison or jail. So ask them, you know what time works for you? And then when they suggest a time and you have that available, let them know, okay, just so you know, there's a lot of people, that tends to be a real busy time here. Unless your whole day is always busy, I'm not sure. Okay, probably is. A lot of them have been separated from their families and they reunite, so just know that as you're getting people in here and you're talking with them, they may have lost their family. That family may have moved away, they don't want any contact with them, they've moved on with their life, and they haven't dealt with this yet, okay? And so you can't just assume everybody just gets out and goes right back to their family. There's a lot of broken families, and there's a lot of mothers and fathers or both parents incarcerated. So you could be seeing kids coming in that have one or both parents in prison or jail, and they're living and being raised by a grandparent or an aunt and uncle or an older sibling. It's just devastating, the numbers of how many parents are incarcerated in the U.S. All right, so trust. It can be hard to gain their trust. They can be a little nervous when they come in. I have found that when they were coming out of prison into our office, I try to, what's your first name? Gabriel, how are you? You just got out a couple days ago. How's it going? Okay. He would like freak out. He's like, what do you mean? What do you know? I'm like, what are you talking about? Okay. And it also threw him that I called him by his name, because in DOC they go by numbers. So what is a number to you guys? Okay, math, Cole, series of numbers, do a number on person. Okay, for them, their number is their identity. The number is what they refer to, 6-digit number at DOC, 6-digit number at the Sheriff's Department. I've had people who have come in, Gabriel comes in, and after he okay, why do you want to know how I am? So, I just want to check in with you to see how things are going. And then I said, I just want to verify some information. Can you give me your date of birth? Okay, and he gives me his DOC or his booking number. And then, no, not that one, your actual date of birth. Oh, okay, because they're not used to that. So security number, you'll get different numbers as well because they're not used to giving that. They're used to giving that 6-digit number because that's who they've been for a while. Here's another one, green light. What is a green light to you guys?
Go.
Go, right? You see green, you go. A green light to an inmate, what do you think that means? There's a hit on their life. It means two totally different things. So the terminology means something different from what we use to what they know. Okay. Not that you're going to tell them that they have a green light when they come in, but you know what I'm saying? Yeah.
I heard of the term halfway house. Is that still current? And then how does that affect their transition back into the real world?
Okay, so good question. So they have halfway houses, and these are clean and sober places that they have to have some kind of a drug history, and they're all around the valley. And a lot of them require money up front, but some will work with them when they come out. And those are for people that mostly don't have a place to go. And so rather than go to CAS, the homeless shelter, it's going to be a place where they're going to have meetings, and they're going to be able to go out and get a job. They're going to be sharing a room with somebody, and average cost is about $125 a week. Some are good, some are not so good, depending on the management and what they're allowing and how they have the accountability going as whether they're holding people accountable or not. And so mostly the people that are going to halfway houses don't have a stable place to go when they get out. And so that's where they'll go until they get some paychecks and get on their feet, and then they may transition into maybe an apartment or find somebody that they can live with.
On average, what's the length of time that someone usually lives there?
In a halfway house?
Yeah.
They like a 90-day commitment, but they don't always get that. So it depends on the halfway house. I know some that are like maybe 5 days, and I know others that are 3 to 6 months. It's rare that they stay longer than that, and then when they do stay longer than that, they will actually make them like a night manager, and they give them a break on their rent and get them involved in the program when they stay longer. Did you have a question?
Yes, just came back. In terms of the language that you kind of alluded to with the green light, I'm thinking about, in our work group meetings, we've been talking about just trying to do better at being trauma informed and how we provide customer service and care. So I feel like the language can be triggering, right, for anyone really, specifically this population. So I'm wondering what other terms, words we might be using, ways that are triggering, this population.
If you say it, you'll know it. Okay, I'm pretty sure if you say it, you're going to know it. But we have like a whole list of different terms that mean something different to an inmate.
So that would be good for our customer service representatives to know, right?
Yeah.
Say as they're receiving somebody.
In the health field, you're probably going to be saying that, but if you happen to say to somebody, some of you just got out of prison, you know, hey, they're ready to go for you in there. You got the green light, go ahead. They're gonna go, whoa, because it is serious life and death. Because the reality of it is, especially in DOC, hits can go out on people, and we don't think that way out here. We think green light means you should go. So if I come across that list, I will send that to you.
Thank you.
Because it was definitely eye-opening to realize that we have two different vocabularies oftentimes. Was there a question back here? Did I miss one? Okay.
I was just stretching, I'm sorry.
Oh, okay. No, that's okay. Scratch away. Scratch in both languages means the same thing.
Okay, there you go.
Coming out of DOC and coming out of jail, this is what we're looking at as far as health issues go. A lot of Hep C. I try to give them handouts, just, you know, whoever wants it, take it, on, you know, what they're doing for Hep C these days, how to live with it as far as exercise and diet goes, but they could use a lot of information on that. They could use a lot of information, and I do cover general mental health and seriously mentally ill. I give them handouts on from NAMI, National Alliance on Mental Health, and I have one-page flyers that I give them pertaining to stress, PTSD, anxiety, depression are the top ones, and so that way they can read about it. The issue with a lot of them that we have incarcerated, whether it's here or in prison with mental health, is that they're not there because of their mental health. They're there because of how they're dealing with their mental health. And so what happens is they're not diagnosed, they don't know what's wrong with them, and then they're self-medicating to feel normal. Or they get diagnosed, they're on medication, they feel good, and then they stop because they feel good, and then they self-medicate. Okay? So we try to educate them on that as well. Through our medical at the Sheriff's Department, if they are seriously mentally ill, they work with our medical people, and they get the case manager involved where their clinic is and get them on the right track with housing and services and stuff for that population. All right, so when I talked to the females the other day, I asked them what was their medical priorities. When they got out of jail, what was their priorities in reference to medical? And almost all of them said they wanted to be tested as soon as possible to see if they had anything before they returned back to their home where their kids are. And that was the women in Estrella jail. They also said that they were willing to make a doctor appointment within a few days of release, which I thought was really good. And as far as preventive testing, they were like, what's that? And so they will get that in about 3 or 4 weeks. Some education on the ages and things of when they should do some preventive health, because that is covered by Access, and we try to encourage them to do that. With the men, a little bit different. They wanted to, wasn't the highest of priorities and they have not been educated about medical and mental health yet. That's coming in a couple weeks. But they're like preventive health care. What are you talking about? And then this is where they said, you know, I'll go if I'm dying, if I'm bleeding out, I'll go, sure. But we want to educate that. We want to fix that so that we can get them healthy sons and husbands and wives, or daughters, or sons rather, and fathers. We want to make sure that they're healthy for their family and educate them on the importance of doing this, especially if they're going to be getting off the drugs and the alcohol. Everybody can educate them. Every time we see these individuals, you can do it, we can do it, everybody can do it. Help us enroll in Access prior to release. That's what DOC is doing. That's what we're trying to do with some of our populations as well. Get them scheduled for an appointment to see a medical provider as quickly as possible when they get out, especially if they have an ongoing problem. And reminder appointments. I was mentioning to him that if they get a text, if they get a phone call, that helps, because it can be very overwhelming when they first get out and they have a lot of appointments to do. They have to go see their PO, they have to go do an intake for substance abuse, they have to, you know, they have another one over here and another one over here, so they may forget their first couple of times that they have an appointment in here and no show unless they get a reminder, so those are always helpful. And then see if they need an appointment at the least busiest time of day, and you can always ask them and see. And then stay educated on current trends, and that's for us, so we can keep them educated on what's going on. And collaborate. So it's really nice to be able to be here and talk to a partner in the community, especially in this part of town, because we can learn from each other. And if we, as we saw from the 85041 project, if we come together and we collaborate and we stay educated, then we are going to help our community. And then ask the patient. That's what I ask the inmates all the time. What about this? How do you feel about that? What's your take on this? That's where I learn what I've learned over the 31 years is from probationers and from inmates. I will ask them, what do you think about this? How does this work for you? that's where your best information is going to be coming from. Questions? Do you realize that you're working with some of these populations when you see them? Do you think about it? Do you always know where they're coming from?
I think that was a revelation for our department at least. Understanding that we had come into an agreement with several health plans a couple years ago to serve specifically this population. So I'm not sure that even everyone at Mountain Park necessarily knows that we are, providing care to this group of people, right? So it starts there. It starts with understanding the health disparity and then understanding what we could be doing in our everyday roles to improve access to care, treat them, with dignity, and understand kind of their backgrounds as they're coming into clinics for their appointments. So at this point, I feel like we have a lot more questions and kind of plans and strategies that'll kind of move the needle in these areas, but it's been kind of a gradual learning process.
It's a population that really needs our help, and the more that we can do for them to make our community healthy and crime-free, it benefits everybody. And you don't necessarily need to know where they're coming from. When you have that person in front of you, look for some of those warning signs, those 8 criminogenic risk factors. Oh, your husband's not talking to you. This is what's going on. And then you know what? That may be a red flag. I'm not sure how many referrals and what kind of referrals you guys do, but there's a lot of places that can help them. I had a mother she got into Perryville, and her daughter ran away the first week because she came in the home to set up rules, because that's what she knew in Perryville. And her daughter was 13 when she went into Perryville, and she was 15 when she came out. If you've ever had a 15-year-old daughter, you know it cannot be pleasant. And so she came back home, and she's like, oh no, you're not associating with this person. You have a curfew now. This is what's going to happen. And boom, 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 she put the rules down, and the girl was gone at the end of the week, ran away from home. And so again, you have under social, a child who is taken off. Okay, and of course she lost her stuff because she was very the mother. She's like, I feel like using. On day 4, she came in the office. My daughter took off. I feel like using. And it's, again, that's how they try to solve their problems. It's the problem solving. We're probably, if we have a kid take off, we're gonna go look for them and try to get them back in and get them some help. They go use, because that's how they deal with stuff. That's how they work. So the 8 criminogenic risk factors are going to be your biggest thing. As you see those and stuff, if you're able to intervene or to give resources or to help in any of those areas, you're going to be really doing a huge part. And you might not even realize that you're doing that, but it will be big. Yeah.
So again, I'll just kind of mention with the work group, we've identified a couple focus areas. I feel like at this point, some of the biggest ones, I have them right here, is again, decreasing the stigma, ongoing education, which we're doing today, and we'll continue to do that in the future. Also reducing barriers when accessing care. So we've been working as a collaborative, again, internally at Mountain Park to look at how we're scheduling care appointments for this population, what other barriers might exist, transportation, otherwise. And so I might even put my colleague Monique on the spot here, because she can explain this better than I can in terms of, maybe Monique, would you mind kind of sharing how the scheduling was happening prior to kind of this new workflow that we've been talking about? And I believe we just got approval on that, and so we're working with medical records to kind of track these appointments internally. So I don't know. I didn't tell Monique I was going to put her on the spot here, but I bug her about it every week at Central, kind of talk about this.
We're just trying to build a better relationship with the plans, and also trying to get them in that timely manner. From hearing before from like statistics, and say 7 days is the most critical. So we're trying to get them in within the 7 days. Again, build a relationship with the health plan, so it saves time for them calling or call for help. And then
Our outsource call center for women.
yeah, and get them the care that they need, the primary care. So that would help decrease maybe like going to the emergency room. I'm trying to think of the other ones that we used for. But that's where we're at now. So we're coming up with the workflow, building a relationship with that health plan, so we can get these patients in a timely manner and have that follow-up care that they need.
Did you guys know that they're getting released, some of our populations out of the county jail with Narcan? 2 bottles of Narcan in their property. Yeah.
Wow. And they gave her Narcan before she left.
Yep. So you'll go down the street to the Circle K on the corner of 30th and Avenue or Buckeye, and you'll see some empty containers of Narcan. Right, that they've already used. They had to start doing that with the population. So just to give you an idea, Gregorio got out of jail, prison or jail. This is what he'd have to do. He'd have to report into probation or parole within a certain period of time. Usually it's anywhere from, well, parole, they're gonna drop you off at the parole office on 16 to 70 grand. If it's probation, he's gotta report within 24 to 72 hours. He also doesn't have ID anymore, so he's gonna have to go down to MVD and pay $12 and get an Arizona ID. He's not gonna get the actual ID, he's gonna get the paper ID. Then he's gotta have an address to be able to send it to for them so that he can get the actual ID. Then he takes the actual ID, he goes to Social Security to get a free duplicate Social Security card because they won't take the paper ID, they have to have the actual ID. So right there, you've got almost between 15 to 21 days of just getting 2 key pieces of information. Okay, and then they'll start looking for employment. They have to go and enroll in. They're going to go down and get their APT card, food stamps. They're going to sign up for medical. They may be looking for clothes. They may be at a halfway house trying to figure some things out. So it's a busy 7 days. But if we can get you in there too, that's huge. That is huge. And we can definitely start suggesting it as well on our end in my classes.
Yeah.
And then word spreads like crazy with them.
Yeah.
And then I also do a lot of stuff with prison people, so I can see what they're doing to reinforce getting medical and getting in there as soon as possible. So.
Even that kind of connecting those dots is helpful for me. I don't know, other understanding of kind of that, what's kind of the priorities as folks are being released, but that's helpful as well. So, yeah. Surveys are going out to kind of just get some final feedback from everyone. I don't know if there's any other questions or thoughts.
Yes.
Do you like some of the resources that you have or referrals that you have? Is there a way that you can maybe share that with like partners that you work with?
Yes, actually, all of my resources are kept up to date, and I have them electronically. I gave him my business card that has my email address on there, and you're welcome to share that with everybody that's in the room, for sure. Yes.
Why don't they help the folks getting out of jail like that, keep the street card and their driver's license ahead of time? Why don't they have them get their driver's license and social security card ahead of time? Is that part of the process, get out and have them something to do the first 14 days? They have
It's
goals?
harder than you think, let me tell you. Actually, I have tried to, we have a proposal, we're building a new jail, and it's gonna be an intake and release center, and we do have a request for a budget for certain laptops that fit the criteria for MVD to be a third-party MVD provider. And it would be on their commissary for them to say that they are willing to pay for the $12 to have an Arizona ID, and we could give them one out the door. That is our goal. I have tried to get Social Security on board with the classes that I'm doing to at least get them Social Security cards to put with their property for when they get out. And sometimes the woman is ready to work with me, and then other times she won't respond to emails or phone calls, and then 9 months go by and she's like, yeah, let's go. And so my last response from her was, I sent her a thing and said, I'm ready to go on this, and she gave me a policy and a MOU of how this was gonna look, and can't get her again. So it's one of those things where it's like, what is going on? But in a perfect world, and this is my dream before I retire again at the new facility that we're gonna have, is that when an inmate gets ready to be released, they're going to have in their property a copy of their birth certificate, if they're from Arizona, their actual Arizona ID, the actual card that we can get for them that we can do there, and then from Social Security, a duplicate copy of their Social Security card, and I already put about some bus tickets in their property. And so they would have all of that, so that when they get out, they would be a lot better off. So that's the plan. We just have, MVD likes to have their money, and that $12 means a lot to them apparently, and so do the birth certificates for the $20 here in Arizona, because it's a general fund, and they really rely on that for certain things. And a lot of these men and women don't have the money, but a lot of them do. And with DOC populations and jail populations, if you have a choice between a honey bun or getting your Arizona ID, they're gonna go for the honey bun, a lot of them will, crazy as that sounds. Okay, and they'll say, well, I'll just figure out the ID when I get out. So, any other questions or anything? You guys have been great, I appreciate the invite coming up.
Yeah, let's give her a
If you have
hand.
questions?
Thank you, sir.